Medullary thyroid cancer is often diagnosed in patients that oftentimes will identify a mass in the thyroid or or a lump in the neck, and they may lead to a workup such as imaging scans to look at the thyroid or other parts of the body, as well as eventually doing a biopsy to determine what the process is that is going on, and that's often how medullary thyroid cancers are diagnosed. Once there's a medullary thyroid cancer diagnosis, oftentimes patients will present to ideally a multidisciplinary team that determines the best way of approaching medullary thyroid cancer. Oftentimes that's a thyroid surgeon or a head and neck surgeon, as well as oftentimes an endocrinologist. So because these are cancers associated with endocrine or hormones, cancer or thyroid cancer endocrinologist is often also part of the team, as well as oftentimes a medical oncologist like myself as well. Oftentimes, scans are done to evaluate the extent of the spread. So this is what we call staging. So staging the extent of how far or where in the body the medullary thyroid cancer has spread to. And that also often includes blood tests looking for proteins or hormones, molecules that are produced by the medullary thyroid cancer. So specifically, there's one called calcitonin and another one called CEA or carcinogen embryonic antigen. And these are oftentimes proteins that are produced by medullary thyroid cancer cells and can be used to follow the disease over the course of treatment as well. Now, most medullary thyroid cancers that diagnosed are sporadic, or in other words, we don't know why they developed, similar to many other cancer types. However, a subset of medullary thyroid cancers can also be associated with some kind of genetic risk or endocrine neoplasia syndrome that's associated with a risk for medullary thyroid cancer as well as other types of cancer as well. So these are called MEN, multiple endocrine neoplasia syndromes. And these are genetic syndromes, again, that can be associated with medullary thyroid cancer. The reason why that's important is because in addition to being evaluated for the medullary thyroid cancer itself, it's very, very important that patients also get appropriate testing, oftentimes genetic testing, oftentimes urine or blood tests to screen or evaluate for other types of cancers that may coincide with medullary thyroid cancers, such as a type called pheochromocytoma. And furthermore, oftentimes, if the genetic testing comes back that a patient's newly diagnosed medullary thyroid cancer is associated with some kind of genetic predisposition syndrome, such as multiple endocrine neoplasia, they oftentimes also need a genetic counseling evaluation for cancer genetic risk, as well as endocrine-specific screening and surveillance for various other issues or medical problems that could be associated with this type of syndrome. So that's quite important.